morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. If you listened in last week, I introduced one of my guests, Clinton Stacy, with Family Wellness Pharmacy and All Good. Is it All Good Family or just
All Good Family Pharmacy?
All Good Family Pharmacy. Had to cut Clint off because we ran out of time. So we're trying to pick up where we left off and recap some of the things that we talked about last week. It's great for me getting we're talking about especially Part D, how the prescriptions coverage hits, and getting that pharmacist point of view, because you've always heard my point of view from an insurance agent. And so it's been actually kind of fun to kind of hear some of how that's going. I'm trying to remember where we left off there, where I did cut you off on the to save it for this week.
Yeah. Just talking, there's a lot of things in pharmacy and independent pharmacy. Right. We value being able to answer questions from our customers and our patients and being available for them. And there's a lot of things that I think patients need to be talking with their pharmacist and questions that they can ask their pharmacist that they don't ask. Yeah. Because there's a lot of things that we can help them with that maybe the pharmacist can't see or don't see when it comes through. So I would ask everybody or urge you to go ahead and talk to your pharmacist. Right. You know, they're available. They're the most available healthcare professional. You can walk up to the counter and talk to them. You walk up the counter. You don't have to book an appointment without an appointment. So they are the most available healthcare professional. Right. So do that. Use them. And in independent pharmacy, we pride ourselves to do that. Right. We're not the ones who are, okay, sit on hold for 20 minutes and maybe we'll let you talk to the pharmacist if you get lucky, whatever. We want to be there and we want to answer those questions and help you in any way we can. Yeah, and you mentioned that you were talking about the formulary exceptions and that you do definitely get involved in that, because that's one of the things. I can't really do anything with that with the insurance companies. My support channel has to do with enrolling in a plan, making sure they get their card, maybe changing, if it's an Advantage plan, changing their primary, who's listed as their primary care. I can help with those kinds of things, some of those billing things. But to talk to the right people about a formula, the people I talk to wouldn't know what to do about it, because that's not, that's not the customer service channel they're in, where you call in on a provider line, basically. We do. It's not very good, but they never are. We're better than what I can do. When we call in, it's still a long wait and hold, because any time you talk to insurance, it's that way. But we can do that. We have a lot of tools in our belt as far as there's also low income subsidies that we can help patients enroll in if they're eligible. Patient assistance programs where the actual manufacturer of the medicines, especially the brand names of the high-cost medications, patients can enroll in patient assistance programs where they'll actually send you the medication in the mail, and it doesn't go through the insurance. Now, one of the things, you probably can answer this. I know I have struggled on this. You mentioned, the patient assistance programs. A lot of those patient assistance programs they have prior to age 65 don't work with Part D. How do you approach that, or how often does that come up to be an issue for your patients? It is an issue. Sometimes we have to look at the whole picture of what's going on, what the patient, what kind of insurance they have. A lot of the copay cards, and we get this quite often, is patients who are on Part D will see an ad for a copay card that they're for a medication that they're on, and they'll bring that in and want to use that, but the federal government and Medicare Part D does not allow copay cards to be used if you're on Medicare. Right. So we can't do that. The patient assistance program, it's a little bit separate from that. So we are able to use that a lot of times on the Part D plans. That's not where you're getting the medicine from us. You're getting it actually shipped directly from the manufacturer. There's a lot of eligibility requirements to go into that. Right. So there's different tools, and each tool is specifically designed for a specific age or subset of patients, and we kind of have to figure out which path we need to go down to help the patient with that. Now, you mentioned the LIS, and thank you for calling it LIS. I hate the government, they want to be make it sound nicer. It's extra help.
if they ask somebody, oh, do you have extra help for your prescription? Oh, yeah, I have this blah, blah, blah plan. And it's like, no, that's your drug plan. That's not extra help.
Right.
Where if you say, do you people who qualify for the low-income subsidy, they're not embarrassed about it.
Right.
They're like, yeah, I'm getting help. Mm-hmm. But you mentioned you help people enroll for that, and I do too. Mm-hmm. What introduces you to, I need to help my customer get that assistance? It's just if they're going to leave something on the counter because they're not able to pay for it, or just conversation from them. You go, you might qualify for this assistance program.
99% of the time, it's just conversation with them where they're telling how they're not going to be able to pay for their medication, their copay's too high, their coinsurance is too high, their deductible, all that kind of thing is too high for them to afford the medication. We can't figure it out on another path to take to help them afford that, and so that kind of steers us in that direction, and we kind of go down that path. Yeah. And a lot of people think that they don't qualify when they might qualify because it's not as strict as some other things.
Right. I would say that's the first level of getting help, because if they qualify for the other programs, they're automatically
correct.
If they have the QMB, the SLMB, and if you have those programs, if you qualify for those, if you're one of my listeners, you know what that is. You qualify for the low income subsidy on your Part D. There isn't anything you have to do on that. It's just kind of like if somebody's drawing Social Security, they don't have to sign up for Medicare when they turn 65. Social Security already takes care of that for them. My thing that irritates me is people who are on Social Security or start drawing Social Security. Social Security makes them just sends out a form. Oh, you might qualify. Send this back in if you think you qualify. There's a lot of people out there that there's my card, and they throw everything else away. Or the reverse is true. I'll get, do I need to fill this out? And I'm like, no, you're not going to qualify.
Right.
You're drawing $2,700 a month on your Social Security, and you have a 401k. No, you don't qualify.
Correct.
Don't fill that out.
Yeah. Well, I'll say as well that a lot of our staff helps us to identify. I mean, we're small, local. We know many of these people. They're our neighbors. They're our families. They're just people we see on a daily basis. So a lot of our staff is really good at identifying those people that may need assistance just based off of knowing what they're paying on their prescriptions. Hey, I don't think Miss Smith can afford this. Can we see if there's something out there to help them?
Yeah.
So that's the time that they take also.
Right.
That's another big benefit of using a local independent pharmacy is the staff gets to know you. Yeah. They actually know the people who walk in and greet them by their name and know their family members. And
we know if they've got a graduate this year. We know if they've had a death in the family. We know if they've had a baby, if they're getting married. Like, we love these people and we know them, and we're here to help them as if they were our brother, sister, or somebody in the family.
So. Well, and the fact is, if you can help them get that low-income subsidy, you are the hero. It's like you can't do any wrong after that kind of thing. I think I've told this story on here before. I know I've told this story to several people. I was actually in my first office, so this is several years ago. But I had this young lady come into my office. She had end-stage renal disease. So she was like in her 30s, maybe early 40s, but new to Medicare. And I don't know what office she went to. I don't think it was the Social Security office, but it was an assistance office, government assistance office. And she came to me with this packet of paper that basically was screenshots of how to apply for the LIS subsidy. And I'm like, you're paid to assist the people who come to your desk, and you send this person out with photocopies of how to do it herself. And I did it for her. I mean,
if you're not in that
how
world,
long does it take to fill out the LIS application?
Yeah, if you're not in that world, it can be a very daunting task to try to figure out what all it needs to require.
It's so simple to do it. And the thing frustrates me, and I don't know if it fits in, when you mark the box that you're assisting and it says there isn't a box for insurance agent. I always had to mark other and then type in agent when I do it, because it's like I'm doing it, and it's like I want them to know, hey, there's us out here who are helping these people.
Right.
Give us a tab on the drop down. But I just hate they took the LIS special enrollment period away from us. We used to use that a lot, especially if you found somebody that, and then you could switch their plan, because now if they're new, again, you still can if they're new. But one of the things that I did, again, that grassroots marketing is, set up an information table in a pharmacy. And then, of course, it's one of those, what they call informal sales events. So it's registered with one carrier. So at that time, I had to represent that carrier. But if the people contacted me later at my office, I could show them any other plan too. But it was a way to get word out of who I was. Now it's almost not incentive to do that. I know that some of the I've actually sat in a Walgreens during the Medicare open enrollment, and it's like, again, it's sponsored by a certain carrier, so you have to lead with that carrier.
Well, I'm glad that there's more agents out there, though, because we have so many patients that come in and is like, hey, it's time for me to enroll, and I have no idea what to do. I have no clue of where to go. I'm not on expensive medications, but what if I have a catastrophic event to where then I am? What do I do? So it's nice to see that there are more people getting into that and being able to help them. Because, I mean, if you're like me, that's not really, I use it and I deal with it in the pharmacy, but I don't know behind the scenes of insurance as well, in the thick of it. So I have a hard time. So that's when I kind of forward them to Clint, who is a lot more knowledgeable than I am. So he can kind of help direct them. So it's definitely a need for our patients. It's very hard to figure it out.
It only took about 15 years of learning for me to get to the point I'm at. So.
Oh, yeah. And I'm still, we're still learning. So actually, believe it or not, we're coming up on that infamous break. And so we'll take a quick break here and let them run some commercials, and then we'll finish up. And we may have to come back another time and do another couple shows, because I think we still just, scratched the surface.
Just scratched it.
Discover the taste of Tennessee with ripe blueberries from Randall Walker Farms of Warren County. Our locally grown blueberries are fresh picked and bursting with flavor. Choose a quart for just $7 or a gallon for $25. Visit Randall Walker Farms at 8240 Manchester Highway in Morrison, Tennessee. Open Monday through Friday, 7 to 5, and Saturdays till noon. Enjoy the taste of fresh picked local Tennessee blueberries before they're all gone. Call Randall Walker Farms, 931-635-9535.
The Putnam County Family YMCA Youth Soccer registration is now open. It's the perfect way to keep your family active and connected. Stop by the Y today at 235 Raider Drive in Cookeville to learn more about their soccer program. They can't wait to score goals with you. Get your kids signed up for the Youth Soccer League at the Putnam County Family YMCA.
And now, back to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance, hosted by Matt Libby.
All right, welcome back. Please support the sponsors who fill those commercial times. It's like we mentioned on the break, we're talking, it's like, I think we just scratched the surface. We're coming up on the second segment of our second show. We may need to do another couple shows just to scratch it. One of the things I'm going to throw out at you, we haven't really addressed is, I think, well, maybe we kind of did. We talked about some of the patient's assistance plans. You talked about a copay card for some of the expensive drugs. We hadn't really talked about the discount programs. Now, there's one out there, and I'm not going to say their name, but that have a very yellow card. Mm-hmm. I used to pass out those cards. I had a big box of 500 cards that they sent me at no cost for me to find out later on. They're actually competing with me because they're part of one of the biggest Medicare call centers that you see advertised. I used to saying, I haven't used it as much because they kind of cracked down on those commercials you're not seeing. I used to always say, don't call Joe. And if you saw any of those commercials with Joe Namath telling everybody, call the Medicare helpline. Well, it's not a Medicare helpline. You're calling into a call center. It's going to get, their sole job is to get you on a Advantage plan. And if you're on a plan, switch your plan. But my thing was, and they advertised on these shows that, people older than me that are just sitting in their recliner because they're very retired, been on Medicare for years. They're watching Gunsmoke, Little House on the Prairie on those, was it Me TV? There's a couple other ones, but that's what they advertise on. And they're like, call and get all your benefits, get the free dental. And they think, Medicare's finally offering dental. And they call the 800 number. Well, these people have been on a Medicare supplement. And some of them, on a supplement that their retiree plan is paying for, and the next thing they know, that they're not getting that, or they get a stipend from the retirement plan to pay, and they switch to a Medicare Advantage plan and lose that money. Or usually it's the adult children go to try to fill mom's prescription, and the pharmacist says that the insurance isn't valid, and they're like, "What do you mean it's not valid? I paid the premium last month."
Yeah.
So that's the one thing. So there's different discount programs out there. As I mentioned, I don't offer the one. I tell people, you can use it, but I don't. There's a company, I don't know if you've seen any of their stuff. I don't know how big they're called, Bax RX. They signed me up to be like an affiliate. They actually have a neat discount program. They do like the standard one of just, hey, here's the discount if the pharmacy participates. But they also have, you sign up for like $30 a month, and they'll ship to your door your generics for that $30 a month. So, but they have to be generic. They don't do anything with brand names other than like discount. The other one is that I deal a lot with, and I don't know if you're how familiar, is the Canadian Med Store, which, of course, if I'm referring somebody there, I'm taking business away from you. So, but the way they do it, six, 7 years ago, I actually met the founder of the company. They're in Florida. He got started. His brother had cancer, and the drugs he had to get were so expensive, and found out, wow, I can order this stuff from Canada and save a lot. So he actually built a business on basically reselling the drugs from Canada. So what they do is they get the prescription. You have to have a valid prescription. They send the prescription. They send it to the pharmacy in Canada, and then it gets shipped to that person. And they have a little markup in it so that to keep the working. So like, I don't know if I want to. That's so funny. I don't know if I want to deal with out of country. I'm like, they're not out of country. They're actually in Florida. But we talked about the different prices of the drug plans. The $95 plan and the $20. And I hadn't even thought of it. I was in a conference. I guess it was in April. Actually was in Orlando, and spoke with Bill, and he was like, and I talked about doing that one. He's like, well, the other thing you can do is put them on the low-cost drug plan, and they get their brand names from us, because they've got several of those, like Xarelto, Eliquis. Those basically it's $50 a month. So if you're on a higher plan, it's got a $47 copay, 40 some, which is probably going to be over $50 this next year for a tier 3 brand name. You get a low-cost drug plan, get your generics through that plan, because a lot of times they're $1 or free. We're not supposed to say free, but $0 copay because it is metformin, lisinopril, those very expensive. And then you order your 3-month supply at $50 a month through the Canadian Med Store. You don't spend $2,000. I was like, oh, I didn't look at that. I need to look at that because, especially, we talked about the commissions. We never made a lot of commission on a drug plan. It was the time involved in helping someone with their drug plan we're never compensated for our time on that. And now that we don't get any commission on it, it's like, I still want to, if I'm going to spend time on it, I hope I can put you on a plan to get commission on. Or, well, heck, if I can move you to this one, it's going to save you money. Well, maybe there's another plan. Maybe now you can't afford a cancer plan, or you can't, I can get that final expense insurance plan because I'm not spending all my money on my prescriptions.
Right.
So those are some of the things. But I didn't know if you'd heard of that. Like I said, that would actually probably take business away from you, at least on those brand names. But they still would come to you for their generics. But obviously, I know you don't want to recommend either. I wish you people could see here. They're arguing. Okay, who's going to address this one? I threw a hot potato on them.
No, there's a lot of discount plans out there.
Yeah,
there's some good ones. Like you mentioned, there's a lot of bad ones.
Yeah.
We get the yellow card that you spoke of because they are really good at marketing. Probably you can tell the better the marketing plan, the worse the discount is.
Yeah.
I guess the main thing too, to know that when you sign up for some of those discount cards, they keep your information and they sell that to other venues or other avenues. So if you do not want your information out there, I would highly suggest not signing up for those, because that is one of the things that we've been told that, hey, their information will get out if they sign up with those. So just buyers beware.
A lot of people don't realize is like, hey, just because you're paying $10 for a drug that's typically $50 doesn't mean it's going to be $10 next month when you go to get it again. That coupon they give you, as I always like to talk about, the cable companies, that's what the way some of the Medicare supplement plans work. It's like, oh, here, sign up today. This for low rate. And in 3 years from now, when we do a double-digit increase on our rate and you're not well enough to change plans because you have health issues, you're stuck on that plan. It's like I said, the cable companies, it's like, yeah, you get it for $30 a month, and then, oh, well, you've had this for a year, it's $150.
9 times out of 10, when someone comes in with one of those discount card, the little secret, it shouldn't be a secret because we've probably not done a very good job of marketing this part of it, but most independent pharmacies have their own discount plan.
Yeah.
And so 9 times out of 10, when someone comes in with one of those cards and says, I want to use this, we'll say no because they charge us an enormous fee to use that card. Mm-hmm. And we end up losing money on that transaction. But we can also give them the same discount on our own in-house, or better.
Or beat it. Yeah, well,
we've beat them many times.
And they're not loyal. they just want what's cheap. They want to pay the least amount. We get that. The good news is you do have that alternative to switch them to. It's just crazy that how much time the Part D stuff takes. I was actually last year was going to had a guest on the show that does primarily group plans. I don't do group insurance. It just takes a lot of time to develop that market, and so I've just stayed on the individual level. But they also do Medicare, so they compete with me there. But they were going to send me all their Part D business because she would, she's like, well, I'm just paying somebody to run all their lists. We don't really make any money. I was like, and I'm thinking, because at the time I was at least getting a small percentage of that. Plus, it also gave me that, again, I help that person. Well, they have a family member, they refer to me. So I still kind of take that attitude of, well, if I'm helping someone save or finding the right plan, they do refer those, as you said, the people that I'm turning 65 and I don't have a clue where to start. That person that I helped save on their prescriptions, I go, talk to Matt. Matt, I got an appointment Monday with a mom and son. He's turning 26 and going off their insurance, and her coworkers at one of my clients is like, oh yeah, we went through that, call Matt.
Mm-hmm. Great.
So there is that, to build it, but it's just our time is finite. We only have so many hours in the day. If I'm spending the whole day on customer service, yes, it pays dividends, but I still need to have, as they call it, income-generating activities every day, not just customer service.
Correct, yeah.
Well, and I'll say, too, that with that discount, we don't have to do that just for those that bring that up. I mean, that's for anybody that wants us to check the pricing. If you're only able to get 30 days at a certain copay, we can look to see what our price would be for a 90-day supply. And sometimes it may look the same as what you're paying for 30 days, but you're getting 3 months at a time and saving you that trip as well. So that's one of the things when Clint said, get to know your pharmacist, ask those questions. There's all kinds of things that we can do to kind of help assist you that you may not even think of in ways to try to save you.
We can deliver, we can mail. There's a lot of ways that we can help save you money as well, too, with independent pharmacies that, chain pharmacies don't do. Can I go down a rabbit hole real quick?
Yeah, sure.
You touched on it just a little bit, and it sparked something in my head, but President Trump signed recently an executive order for most favored nation pricing for medications. So a lot of in a little bit of time, it'll take a little bit of time before it starts kicking in, really. But what we expect to see is the difference in prices from, let's just say, Canadian medicine and the prices here in the United States to come equal out with that. And that will be a huge benefit to Medicare customers. All customers who are taking medication should benefit everyone greatly. So I think that's going to be a huge, huge thing for us going forward as well.
Yeah. Well, it's like you mentioned earlier about the PBMs. It's like, that they're the culprit is you have a drug that's manufactured in the United States and then sold to a pharmacy in Canada, shipped to Canada, and then that pharmacy sells it and ships it back to you, the consumer, for less than you can get it at your local pharmacy. There's something broken in the system, and I know we don't have time to get into that today. We're actually coming up on running out of time, but again, I mentioned on last week's show, but give you a moment here. How do people find you?
You can find us at All Good Family Pharmacy, located across from the All Good Walmart. You can call us at 931-537-6337, or you can find us at Family Wellness Pharmacy at 330 North Oak Avenue, next to the hospital, and you can reach us at 931-559-6337.
All right. And again, as I always say, we'll talk to you next week on the radio, and always remember at Matt Libby Insurance, we can cover you head to toe. Doesn't have to cost you an arm and a leg. Please go to insurancematchmaking.com. Has links to my YouTube channel of recordings of my past shows. There's also have a question for the show, or if you got questions about my guest and say, they gave their number, what was it? What was the name of the pharmacy? And we can forward that on to you also. So we'll talk to you again next week.
Thanks for tuning in to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance.